Madam Speaker, I would yield 3 minutes to the gentleman from Virginia, Representative Goodlatte.
The gentleman is recognized for 3 minutes.
Thank you, Madam Speaker. I want to thank the gentleman from Colorado and the gentlewoman from Guam for bringing forward this bipartisan resolution honoring Cold War veterans. I, too, also commend the importance of understanding the history of the Cold War and of what President Kennedy did with the airlift into Berlin to protect the people of that city. What happened during the 1980s when President Reagan called the Soviet Union exactly what it was, the evil empire, and later went to the Berlin Wall and called upon Mr. Gorbachev to tear down that wall. It was the brave men and women who served in our armed forces who made that possible in our history, to see the ability of our president to stand up to the Soviet Union and indeed to see that wall torn down not that many years ago. I will tell you also, however, Madam Speaker, that we have before us in this Congress today and tomorrow health care legislation, a massive bill. When you take all of the pages of all the bills that are being considered here, the House bill, the Senate bill, the reconciliation bill, you are talking about thousands and thousands of pages. And tomorrow we will have a couple of hours for 435 members to talk about what is in those bills. So I have no doubt that the millions of American veterans who served their country, and many of whom are baby boomers and will be facing $520 billion in cuts in the Medicare program to pay for a new government program at a time when our nation is broke, that they're going to be as concerned as all of us are here today about this health care legislation, this monstrosity that's going to include $569 billion in tax increases that will cost millions of American jobs. They will be concerned to hear from the 130 economists from across the country who sent President Obama a letter explaining how this legislation is a job killer. They will be concerned about their children and grandchildren who will inherit the enormous debt that is a product of this legislation, because unlike the specious claim that this will indeed result in in deficit reductions, they know that when you have a side deal of over $200 billion to take care of physicians under the Medicare bill, when you have a bill that provides 6 years of coverage with 10 years of tax increases and Medicare cuts, that does not balance out. In fact, this legislation is hundreds and hundreds of billions, some say more than $1 trillion greater in cost than will be taken in revenue and Medicare cuts. The result of this is going to be devastating for our country. Madam Speaker, I urge my colleagues to reject this monstrosity.
Gentleman's time has expired. Gentlewoman from Guam.